The views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management. Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Good afternoon, everyone. I am Aga Aison, Product Manager from Zydus Healthcare Philippines. Welcome once again to our Health Talk, your weekend source of good talk on good health. Health Talk. Isang magandang hapon po sa inyo lahat. Today is November 8, 2020. Good thing at tapos na po yung bagyo at sana po ay lahat po kayo ay in good condition, in good shape, and very much safe together with your loved ones. So for today po, we are very much happy that we are going to bring you another exciting and helpful topic, of course, to be discussed by our lung expert doctor. So our topic for today is entitled Breathe In and Leave Out. So especially these days, right, we are very much conscious with the air we breathe because it's very much essential that we are only inhaling the good air, the fresh air, tama po ba? Especially at this time of COVID-19. So it's also important that we do some breathing exercises. And when we talk about exercises, it's not just about having the good physical health. Of course, you will be physically healthy, okay? But at the same time, it's more important that we get the good health, the beauty, kumbaga, that meets more than what the eye can see. And we're talking about our lung health and even actually our heart health. So that is what our doctor speaker will be talking about this afternoon. So speaking about our speaker, I would like to introduce Dr. Grace. Our speaker, Dr. Grace Pancho, is actually a pharmacist who graduated from the UST school. And of course, she also took her residency of internal medicine at the Manila Doctors Hospital. And of course, she had her pulmonology fellowship at the same hospital, Manila Doctors Hospital. So to talk about exercise and the lungs so that we could breathe in and leave out to be more productive, especially with the tips and guidelines that we really needed coming from our lung expert, Dr. Grace Pancho.
Hello, good afternoon, everyone. Thank you for joining us this day. And we will talk about the exercise and the lungs. So this afternoon, we will be breathing in and we will be living out. We will try to accomplish a very healthy lifestyle. So let's start this discussion. What are we going to talk about this afternoon? So first, we will discuss and define what is exercise, the benefits of exercise, what happens in the lungs during exercise, and can those who have pulmonary diseases exercise? So those will be the topics, the outline of our talk this afternoon. So let's define exercise. This is more of a medical definition of exercise. So exercise is a physical activity that is planned, structured, and repetitive for the purpose of conditioning any part of the body. So take note po ang exercise daw should be planned, structured, and repetitive para magkaroon ng effect sa ating lifestyle, sa ating health. And hindi ito tulad nung pagising mo sa umaga, ay parang gusto kong mag-exercise, and then ang susunod na next month, no? It should be a habit, it should be repetitive, and structured. Talagang yung routine natin for that day, talagang pag-iisipan. So, what are the benefits of exercise? Madali lang to i-search sa Google, no? Pagka i-search mo sa Google, napakaraming mga results ang lalabas. And we all know na ang pinaka-common reason bakit tayo nag-exercise ay dahil sa weight gain. Gusto nating mabawasan, lalo na ngayong pandemic because of our sedentary lifestyle for the past months. 7 months din tayong halos nasa bahay. And because of all the online activities, nakaupo din halos maghapon. 8 hours, wala nang lakad. And because of that, nagigain tayo ng weight. But let us focus on the other benefits of exercise. We would like to emphasize today that exercise reduce the risk of serious medical illnesses. So ano yun? Mga sakit sa puso, yung stroke, diabetes, and even cancer. Pwede daw ma-reduce yung risk. Take note ha, risk. Ibig sabihin, it can still happen, but the chances that it will happen is less. Being active can help you stay active. Kasi as we exercise, nagiging mas malakas yung muscles natin, yung bones natin, we become more flexible and agile, no? Sometimes because of aging, nagkakaroon na ng edad, nagiging less yung activity natin. But as we exercise, nagkakaroon tayo ng nagiging mas malakas tayo for our daily activities. Mental wellness. It is to improve attention and memory. Pwede rin daw i-reduce yung risk for dementia and Alzheimer's disease. Napakaganda, no? And aside from that, it also uplifts someone who is down. Yung mga good hormones natin, happy hormones, nare-release din during exercise. So, ang dami-daming benefits ng exercise, and maybe it's time to really decide to start now, to create a decision na towards a very good habit, a healthy lifestyle. A healthy lifestyle not just composed of diet, but composed also of exercise. So what happens to our lungs when we exercise? Syempre, ang dami nating physical activities, the movements that we do. And the lungs, siya yung responsible to bring in the oxygen into our body to provide the energy. And also, dahil nga inhale, exhale, yun ang ginagawa natin sa exercise. Also, it removes the carbon dioxide, the waste product, when we that is created when we produce energy. So the heart also pumps the oxygen to the muscles that are doing the exercise. So ganun ang collaboration ng lungs and heart natin. No? They join together, they help para mabigay yung energy na kailangan ng muscles natin. As you saw dito sa video na pinakita natin, the exchange of oxygen and carbon dioxide. When we exercise, your muscles work harder. Diba? Lalo na yung mga nag-undergo ng HIIT, high intensity interval training. You work harder and your body uses more oxygen and produces more carbon dioxide. But you don't have to worry about this kasi yung lungs natin can cope with this extra demand. So, kaya nagkakaroon tayo ng mabilis na paghinga. So, nagiging 40 to 60 times a minute yung respiratory rate natin during exercise. And this is not bad because this is the coping mechanism of our body. So, as we increase the frequency of our breathing, pati yung dami ng hangin na pumapasok sa katawan natin, nag-i-increase din. And when our lungs are healthy, nagkakaroon din tayo ng malaking reserve to breathe in and breathe out. So, minsan, pagka nag-exercise tayo, talagang hingal na hingal, we may feel out of breath after exercise, but hindi ibig sabihin nito we are short of breath or yung pathologic na hingal, magkaiba siya. So, ito yung magandang nangyayari when we exercise. The lungs helps us para masustain yung activity na ginagawa natin. Now, alam natin kasi exercise is really prevention para magkaroon tayo ng mga sakit. Pero what if meron na tayong sakit? May mga sakit na tayo sa baga. So, I'm sure meron dito ilang makakapanood na meron ding sakit sa baga, COPD, asthma, or maybe you have someone you know, part of the family or friends na meron sakit sa baga. And this is the good news that you have to tell them. Pwedeng-pwede silang mag-exercise. So, exercise or exercise training, which is part of pulmonary rehabilitation, a more systematic approach for this, is indicated for individuals with chronic respiratory disease who have persistent symptoms or disability despite standard medical therapy. So pagka daw ikaw ay may lung disease, hindi yan dahilan para ikaw ay hindi na mag-exercise. It is indicated, it is recommended, it is required. You are very much encouraged to exercise. Lalo na dun sa mga meron ng chronic disability. Makikita mo yung mga COPD, sila talaga yung mga oxygen dependent na. Tapos ang dami-dami na nilang inhalers. Sila talaga yung mas ine-encourage na maging part ng isang rehabilitation, pulmonary rehabilitation program or simply exercise training. Ano-ano ba yung mga pulmonary diseases na recommended ang exercise? First of all, chronic obstructive pulmonary disease. Mas maraming mga studies and researches na ng exercise sa mga COPD patients. Kaya yung mga discussion natin later on, more on focus for this set of pulmonary patients. Also, for those na may asthma, it is also recommended na mag-exercise. And then the other pulmonary diseases, bronchiectasis, mas marami silang, mas productive yung plema nila. Cystic fibrosis, mas common sa mga Western countries. Chest wall diseases, associated sa mga neurologic problems. And the interstitial lung disease. So, in general, exercise is recommended in pulmonary diseases. Pero, exercise cannot be done, of course, in specific individuals. Siyempre, pagka nag-exercise, hindi natin pwedeng gawin yun dun sa mga, may mga disabling arthritis. Yung, kuwari, yung talagang hindi na nila maunat yung mga extremities nila. Of course, we will not force them to do yung mga physically active na exercises. They have specific rehab programs for them. And also yung may severe neurologic diseases, yung mga bedridden, mga hindi sila pwede yung very active exercises, cognitive or psychiatric diseases. So not all can do exercise. And also comorbid conditions that might place the patient at risk during exercise training. So tulad nung complications ng COPD, yung merong mga severe pulmonary hypertension or tumataas yung pressure sa baga papunta sa puso papunta sa baga, or unstable cardiovascular disease. Of course, yung may mga atake sa puso, iingatan natin sila. Hindi lang basta-basta mag-exercise. They need to undergo proper program or rehabilitation for cardiovascular rehab program para ma-facilitate yung mga physical activities. And so, exercise training is very important because it improves endurance. So, kung dati, ilang hakbang lang nakakaramdam ka na ng pagod, pwedeng mag-improve to with exercise training. And also, it increases the level of function. So, makikita nyo sa picture nito, the upper extremities, yun yung ina-exercise. And in COPD patients, yun yung mas nalilimit yung activities, yung involve yung upper extremities. So, mas makakaligo na sila mag-isa, mas masusuklay na nila yung buhok, makakapagbihes. So, that's the level of functioning na maibabalik ng exercise. Aids in performance of activities of daily living. So yun, mas makaka-move around na sila sa bahay or baka after pandemic, pwede na rin silang makapasyal, makapunta sa park or saan man. It helps reduce systemic blood pressure, improves lipid profiles or cholesterol levels, counteract depression. So, usually yung mga patients with pulmonary diseases, nagkakaroon talaga sila ng depression. Because yun nga, hindi na sila very functional. Very limited na yung kaya nilang gawin. Even the daily living exercises, activities, hindi na nila kaya. So, nababawasan na yung parang self-worth nila eh. Parang feeling nila, wala na silang silbi, baliwala na sila. So, ito yung nagiging cause kung ba't sila nade-depress. And also, it reduces the anxiety associated with dyspnea-producing activities. So, dahil nga konting hakbang lang, hinihingal na sila, so, natatakot na silang gumalaw. Kaya para siyang cycle. Na hinihingal sila kaya hindi sila gumagalaw. Pag gumalaw sila, hinihingal sila. So, yung paikot-ikot na yon, ang tendency is really maging sedentary sila, immobile. But exercise training can improve all of this. So, particularly in COPD patients, mapapansin natin, mas lumiliit yung muscles nila, no? In patients with chronic lung disease, yung peripheral muscles sila, nag-undergo ng wasting. So, makikita mo talagang lumiliit yung muscles sila. And because of this, syempre, yung lakas ng muscle, nababawasan din, no? So, it contributes dun sa factor kung bakit hindi na sila gumagalaw. The use of upper extremity muscles is also associated with dyspnea. So imaginein mo, pati pagkilos nila sa COPD patients natin, usually tinatanong din natin, kaya nyo pa bang magbihis? Kasi syempre pag nagsuot ng shirt, tataas yung kamay, and with the movement of the upper extremities, nahihirapan silang huminga, nagkakaroon ng dyspnea or hingal. And because of that, talagang yun ang fino-focus natin dito. Building up the extremity muscles. So, the emphasis is upper and lower extremity endurance. So, ibig sabihin, after repetitive movements, kaya nilang masunod-sunod pa. And also the strength. Tapos, ang exercise daw nila, it will be minimum of 20 to 30 minutes, 2 to 5 times a week. Actually, ito rin yung minimum requirement for those na those who are healthy or normal, yung walang pulmonary diseases. We are required to exercise minimum of 30 minutes 3 times a week. So, or most number of days. So, ganun din ang mga pulmonary patients, yung mga may sakit sa baga, we are encouraging you to have a sustained exercise for about 20 to 30 minutes, 2 to 5 times a week. So, most number of days. And usually, yung exercise na pinapagawa sa kanila, hindi maximum. So, ano lang, 50% lang nung maximum work rate nila. So this is an example. The video dito sa taas is an exercise of the upper extremity. So makikita mo, guided siya by maybe a therapist. Tapos, meron silang weights na hawak, maybe 1 pound or 2 pounds lang siguro yan. And then repetitive. And makikita nyo, slowly. No? Very slowly. Kasi nga, inaalalayan natin na hindi siya hihingalin habang ginagawa yung exercise. So after the demo, hinahayaan naman siya na gawin yun on his own. So itong video naman, dito sa ibaba, makikita mo naman, ayan, yung lower extremities naman ang ine-exercise natin. So if you can see, syempre may assistance pa rin, nakahawak, and very, very slowly, alalay na alalay yung movements na pinapagawa sa kanila. So maybe if you are if you have pulmonary disease, you have COPD, and medyo nagkakaroon ka na talaga ng ganitong anxiety related na because of the movements, you can start doing this. Actually, you can see this video sa internet. And pero importante, magpaalam muna sa doktor, ha? Before po tayo mag-initiate mag-exercise kasi baka mamaya hindi pala pwede talaga sa level ng yung level ng sakit mo, talagang medyo severe na yung lung problem mo. So even if your mind feeling niya kayang-kaya mong gawin to, ask muna the clearance from your doctor if you can. And most probably, they will recommend you to undergo really a pulmonary rehabilitation program kung talagang kailangan. So, some of the exercises, ayan, focus on the lower extremities, stationary ergometer or bike, motorized treadmill, climbing stairs, pwede rin, and walking on flat surface. And then, exercise for upper extremities, arm ergometry, lifting free weights or dowels, yung bilog yata yun, and then stretching elastic bands. So, after pandemic, you are very much welcome to visit a hospital na merong rehab center and then inquire kung ano po yung exercises or program na pwede nyo gawin. But as of now, you talk to your doctor and ask for clearance, and then you can use the videos on YouTube. And I think some rehab doctors, rehabilitation medicine doctors, have telemedicine. Maybe they can assist you. So, if you will notice, medyo maliit lang kasi video kanina. Yung video na pinakita ko, habang ginagawa niya yung exercise, nakaano siya, pursed lip. Parang nakaganon. Parang humihigop sa straw. So this is also very important that as you do exercise, very important to sa mga COPD, naka-pursed lip breathing tayo. Bakit tayo magaganito? Later on, ipapakita ko sa iyo. But this technique facilitates the recruitment of abdominal muscles during exhalation and has a favorable effect on the breathing pattern. So, in COPD patients, they have this condition na nagkakaroon ng hyperinflation. So, parang plastic balloon. Pagka binugahan mo, lalaki. Tapos, nilagyan mo ulit ng hangin, mas lalaki. Tapos, mas lalaki. In COPD patients, yung baga daw nila has less capacity to bring out the air inside the lungs. So, yung hangin sa loob ng baga because of the effects of COPD, hindi niya fully exhale lahat ng hangin. So, may natitira. And then you breathe in, hindi mo na naman ma-exhale, madadagdagan na naman. So, because of that, mas kumukunti yung hangin na kayang pumasok sa baga mo dahil nga may natitira. And it causes shortness of breath again, yung sensation na hirap huminga. Kaya this is very important. So I'll show this video, an instructional video. And kung nandyan ka ngayon at may COPD ka, pwede mong sabayan.
Breathing, sit down in a chair and relax your neck and shoulder muscles.
So you have to relax
Breathe in
now.
slowly through your nose, making sure to keep your mouth closed.
Breathe in slowly through your nose.
Some people find it helpful to count to themselves. Inhale 1, 2. Pucker or purse your lips as if you were going to whistle or gently blow out a candle. And then breathe out or exhale all of the air in your lungs through your mouth slowly and gently through pursed lips.
Okay?
Try to breathe out longer than your inhale. Some people find it helpful to count to themselves. Exhale 1, 2, 3, 4.
Okay. So this is a video from the American Lung Association. Para daw pumipito. Ayan, yun yung instruction namin, parang pumipito. Mag-i-inhale ka sa ilong and then when you exhale, parang pumipito. And then dahil nga yung in-explain ko kanina, mas nadadagdagan yung natitirang hangin sa baga, tatry daw natin na mas mahaba yung pag-exhale kaysa sa pag-inhale. So, inhale, and then, okay. So, you can try that after this session.
Breathing, sit.
So, nabanggit natin kanina na isa dun sa mga pulmonary diseases na kailangan ng exercise ay ang asthma. So, ang mga asthmatics, they are also encouraged na mag-exercise, no? Alam ko mas madali rin silang hingalin. Pero, meron lang tayong konting caution kasi meron tayong tinatawag na exercise-induced asthma or exercise-induced bronchoconstriction. But this is more common dun sa mga athletes na talagang sumasabak sa matinding training, yung mga nasa Olympics, yung nagtitraining sa cold weather or sa talagang mainit na weather, extreme conditions of environment. Sila daw yung more at risk dito. So, meron tayong tatlo ditong column. Those who are high risk na mag-develop ng exercise-induced bronchoconstriction, ito daw yung mga sports na involve ang more than 5 to 8 minute effort in a dry or cold air environment. So, mga track and field, cycling, ice hockey, ice skating, di naman yun common dito sa Pilipinas, biathlon. So, they can be at risk of this bronchoconstriction. Pero dito sa mga low-risk sports, kasi less than 5 to 8 minute effort lang na may ginagawa, so pagpilian nyo na lang kung medyo may kaya, golf ang exercise natin. Pero if yung mga exercise natin ay less than 5 to 8 minute effort lang, mga parang burst of activities, low risk lang naman. So you can do those kinds of exercises or maybe be in part of a sport na gano'n ang ginagawa. But I want you to take note of the lower part of the table. Nakita niyo dito swimming. Kasi meron tayo 'di bang connotation na sabi-sabi na swimming is good for those who are asthmatics or para sa mga sa baga, pampalakas daw ng baga, no? Kasi 'di ba si Regine Velasquez nga gumaling daw kumanta dahil nag-practice siya ba nakalublob sa tubig. Well, swimming is good for asthmatics. Pero, for some reason daw, mas at risk daw sila for bronchoconstriction. Lalo na if prolonged time silang nakababad sa chlorinated water. So, in-associate nila na yung mga athletes daw na nagkakaroon ng bronchoconstriction, it's because of the chlorine ng pool. So, makikita nyo across the board, swimming can be a high-risk sport or low-risk. So, ibig sabihin, kung mga short lang naman na effort, aahong ka rin naman sa pool, 5 to 8 minute effort, pwede ka naman mag-swimming or maybe after pandemic, sa dagat na lang tayo pero walang chlorine. So, you just have to be mindful of this pagka ikaw ay asthmatics, no? Asthmatic. But this is very important. Exercise is not an alternative treatment for our pulmonary diseases. Baka sabihin mo, ay hindi na ako mag-i-inhaler, pwede naman pala mag-exercise. Hindi po. Ang primary na gamot pa rin for our pulmonary diseases ay bronchodilators or yung inhalers natin, no? So, wag na wag po nating ipagpapalit yon or i-give up yung bronchodilators, yung mga inhalers natin dahil yun po talaga ang kailangan nyo, no? For some, talagang medyo nakakainis na dahil 1, 2, 3 inhalers ang gamit natin, no? Pero it is really important na ginagamit natin yung bronchodilators natin, yung mga inhalers natin, mga gamit natin. And then, if you are dependent on oxygen, huwag nyo pong tatanggalin. Minsan sasabihin natin, ay ayoko nang gumamit niyan kasi mahihiyang ako, baka hindi ko na yung matanggal, baka maging dependent ako. Gusto ko pong maintindihan nyo na hindi po ganun yon. Baliktad po. Kaya po tayo gumagamit ito dahil unang-una, primero, kailangan na yan ng katawan natin. So, kaya tayo gumagamit ng inhaler dahil kailangan ng katawan. Kaya tayo gumagamit ng oxygen dahil kailangan ng katawan. Hindi po baliktad na ayaw natin gamitin dahil baka masana yung katawan natin. Hindi po. Kaya natin yung gagamitin, again, dahil kailangan ng katawan natin. So, I'm about to end my presentation. In conclusion, paalala po ulit, exercise is a physical activity that is planned, structured, and repetitive for the purpose of conditioning any part of the body. No? It is structured, kailangan po planado. Exercise has lots of benefits, alam po natin yan, healthy ka man, at lalo na dun sa may mga sakit sa baga. Exercise is recommended. You are highly encouraged to start an exercise program pagka ikaw ay may pulmonary disease. And before you start a routine, ask your doctor kung safe ba sa iyo yun. So, thank you again everyone, and I hope with this discussion, we will be able to breathe in and live out, achieve a healthy lifestyle, and we hope that after the pandemic, yung immobility natin ngayon, mababawi natin. We will be more mobile after this. And thank you everyone for for joining me this afternoon.
All right. Magandang hapon ulit, Dr. And thank you for that wonderful discussion. I was actually talking about with my wife about the exercises because meron po kaming lola na meron ding, yes, she has asthma as well.
Mm-hmm.
And we were talking about, you walk every morning para po makalanghap ng sariwang hangin. And she's still very much healthy at the age of 94.
Wow.
But unfortunately, she died already. But I mean to say, when she was still 90, 94, she still walks around the house as her exercise. Kaya pinag-uusapan namin si Lola. Ayan. So, thank you so much once again, Dr. Grace, for that discussion. And you mentioned also about rehabilitation medicine doctor, no? Who are responsible in teaching their patients on how to move properly, especially if they have underlying conditions. And speaking of which, we actually had some speakers in the past who are from rehabilitation medicine talking about what are the exercises they can do if they have arthritis, ganyan. Ayan. So, ngayon naman, it's a very good perspective because it's coming from the pulmonologists themselves talking about healthy lungs and exercises to have healthy lungs. Yeah. So nakakatuwa din that you've showed some videos which our audience can actually follow and also do as a breathing exercises. Yeah. So, Dr. we have some questions already from our viewers. And actually, they were very much happy to hear from your tips and guidelines. No? But before we entertain the questions from our audience, I just have one or two questions lang just to jumpstart
Sige, Sir
our
Aga.
our question and answer portion, Q&A portion talaga. Ayan. So, we know that exercise, of course, doing exercise, especially at this time of pandemic, may mga quarantine, you can't go out, di ba? Limited kasi yung mobility. For example, even going to the gym or going to the park, ang daming restrictions and all of that. How do you advise your patients po, or even the public, to still continue doing some exercises even at their homes? How is it important po?
Napakaganda ng tanong mo, Sir Aga, kasi I just decided to resume my exercise. Oo. Talagang yung pandemic kasi it caused us to be sedentary, maghapon nakaupo, lalo na yung mga Zoom meetings natin, yung Zoom fatigue.
Precisely.
So, buti na lang, nandyan si YouTube. Si YouTube, pwede niya tayong i-assist. So, you can search for Kung magsa-start pa lang kayo ng exercise, pwede niyong i-search yung low intensity exercises or kung ano yung gusto mo. If you want in the form of dance, if you want in the form of Zumba, kung gusto mo naman talagang physical, meron ding mga walking exercises. So you can search for that sa YouTube. And pwede mo ring i-search kung ilang minutes mo lang gustong mag-exercise. So, napakadami pong available ngayon. Mukhang talagang YouTube is ready for the quarantine and pandemic. Nandun lahat ng sagot natin.
Yeah.
But yes, ganun pa rin. Still, we aim na minimum of 30 minutes, most number of days sa loob ng isang linggo. It will really help. And it will break the routine kasi nga hindi tayo laging nakakalabas. It will help us not experience cabin fever, yung mga talaga nagiging anxious dahil nga nakakulong lang tayo sa bahay. So it will really help, lalo na yung mga seniors natin. So yung mga anak dyan, you can just turn on your TV or laptop and then i-assist nyo sila kasi hindi sila tech savvy. Assist nyo sila kung ano yung exercise na pwede nilang gayahin and just enjoy kung ano man yung exercise na pipiliin ng ating mga seniors.
Yeah. Thank you, Doctora, for answering that. Actually, you mentioned about YouTube, no, and of course, the different exercises that we can do at our homes. Mas naging creative yung mga Pinoy, no, particularly in doing some exercises. We could see in their IG stories or Facebook, minsan nagla-live pa, nagsusumba, stationary biking.
Yung TikTok nga naging exercise na rin eh.
Tama.
Siguro, Sir Aga, may TikTok ka.
Wala po. Don't tempt me. Pero Doktora, I can sense na, and actually I heard that you are actually physically active also and a sports enthusiast. That's actually my second question. Tama po ba ako, Doktora?
Well, hindi naman as in physically active. Siguro nung kabataan ko, oo. Pero before this pandemic kasi ito kasing pandemic ay na-force akong gumamit ng kotse. Dati nagko-commute ka, naglalakad ka, so may walking talaga nangyayari. And yes, I tried to go to the gym and jog around. Pero ito talagang pandemic, nakulong talaga tayo.
Yes. And actually, when it comes to exercise naman or having that good physical health, internal health, is sabi niyo nga, Doktor, diba, young, old, everybody actually should exercise to be really healthy, especially to ensure that our lung is very much healthy. So we could breathe in and breathe out properly. Breathe in and live out, sabi niyo nga, Doktor. Live out. And when we say live out, it's being more productive, diba? Doing our daily routine. Whether we work at home or we go back into the office, into the clinic, and all of that. All right. So, Doctor, I think we should start entertaining some questions from our audience po. Ayan. So, we have here actually a question from Ma'am Susana Kerolihico. Doc, bakit ako nagkakasipon, makati ang lalamunan tuwing umiinom at kumakain ng malamig? At pag pinabayaan ko ang ubo, nagiging ubo kaagad. Pag palagi ka ba inuubo kaagad sa isang buwan ang pagitan, pwede ba uminom ng antibiotic or sunod-sunod sa 2 buwan? Yan, sipon, tas naging ubo pala daw. From sipon, it became cough. From colds to cough.
Okay, so maganda rin itanong kung this year lang ba nangyari yan o talagang dati pa. Kasi maybe it's allergic cough. Baka because of, syempre pag malamig talaga yung tubig, there are some conditions na tulad na nabanggit ko kanina, extreme temperatures. Pag sobrang lamig, nagkakaroon ng bronchoconstriction o kaya baka naman nai-irritate lang yung lalamunan mo, nagugulat sa lamig. Pero we have also conditions na tinatawag namin upper airway cough syndrome. Lalo na doon sa may mga rhinitis o sipon. Ang sipon ay pwede rin bumagsak sa likod ng lalamunan. Kaya kung minsan, pag nagsimula kang magsipon, dediretso na ang ubo kasi initially because of the irritation and maybe because of start sa upper respiratory tract, bumababa na sa lower respiratory tract, nagkakaroon ka ng pulmonya. So, better na aagapan, lalo na yung sa'yo, paulit-ulit ka mo, better na talagang magpa-check up ka na sa doctor, no? If very worrisome talaga, you can go to a clinic or a hospital. Marami pa rin takot pumuntang ospital ngayon, pero if it is really needed, you go to the hospital. Protektahan mo lang yung sarili mo, face mask and face shield.
Ayan. Thank you for answering that question, Doktora. No? Kasi may mga, may mga still kinakabahan going to the clinic, especially when you already have cough or cold. Baka they might think that it's a sign of a bigger problem, kumbaga. So, good thing that there's telemedicine or teleconsultation. Or if it's really needed, tama po yung sinabi po ninyo, no, that that's the right time to really go out and seek professional advice physically.
Oo. Kasi tulad niyan, paulit-ulit, baka kailangan din ng mga test like x-ray. So, important na magpatingin ka na sa doctor.
Yes po. Doktora, you mentioned about a certain exercise. I mean, hindi lang isa eh. Marami po kayong pinakitang exercises on ilang exercises. What could be the best lung exercise could you advise to a certain patient? Probably for those with, siguro let's categorize mild, moderate, or severe respiratory condition. Or pwedeng 2 categories.
Okay. For those na may mild respiratory conditions, i-assume natin na sila yung mga hindi talaga symptomatic. So, ibig sabihin, they can perform intense activities or talagang they can still be physically active, kaya nila mag-exercise or mag-jog around nang hindi napapagod, pwede nilang gawin yung exercise ng normal na tao, no? Because yun nga, hindi sila ganun ka-symptomatic or hindi disabling yung sakit nila. In the premise na nandoon yung gamot nila. No? Baka mamaya hindi na nila i-take yung gamot nila. Of course, ask your doctor if you can do the exercise. Doon naman sa mga talagang yun nga, yung disabling na yung pulmonary conditions nila, you can start slow. May mga binanggit ako kanina, pero tulad yun, for the lower extremities, you can start walking around your home. Depende sa pacing mo, wag kang ma-pressure na kailangan, mabilis na ako maglakad. No. Yung pacing mo, yun yung susundin mo. And yung duration, yun din ang susundin mo. And then, habang ginagawa mo kasi siya everyday, makikita mo, madadagdagan yung nakayanan mo the week ago or month ago. So, unti-unti po. So, malaki yung difference. If you have mild pulmonary disease, maybe you can still do the exercises of a normal person, a healthy person. And if meron kang disabling pulmonary disease, start slow, but be consistent and still take your medications and ask your doctor if you can start that exercise.
All right. Thank you. Doctor, a follow-up question. Does that mean that if they go to a pulmonologist, they could prescribe, some exercises that they should do based on their category, kumbaga?
Actually, dito sa Pilipinas, hindi pa widely parang kinoconsult yung pulmonary rehabilitation for this diseases. Sa ibang bansa, yes, nagagawa to kasi ano tawag ito, yung mga insurance, di ba? Reimbursement. Doon, sagot ng insurance yung, syempre, that's another doctor, so that's another expense and also the sessions. Pero dito sa Pilipinas kasi hindi pa siya widely accepted or a practice. But a pulmonologist can guide you. Pero ang talagang dito sa atin, ang pinaka-message for the exercises ay the rehab doctors. No? Rehab doctors, some pulmonologists specialize in pulmonary rehabilitation. So you can look for them. And some cardiologists specialized with cardiovascular rehabilitation. So meron din yun, magkakaiba rin yun. So you can ask your doctor kung kailangan mo ng specialized doctor for your condition, or he can already give you the prescription of the exercise.
Yan. All right. Thank you for clarifying that, Tora. We have a text-in question po, and he is asking po about the EIB and EIA. You mentioned about exercise-induced
Exercise-induced.
bronchoconstriction and exercise-induced asthma.
Mhm.
Ayan. So there are many kinds of sports like light, moderate, mga ganun po na sports, no? Or low intensity, etc. He would like to clarify if that's only for athletes or even for non-athletes.
Oo. So yung studies kasi na related dito ay ginawa talaga sa mga athletes kasi syempre controlled environment sila yung laging ginagawa yun, no? Kaya yung mga researches about this, more on for athletes. Pero kung titingnan natin, yung mga athletes kasi, babad sila talaga sa exercise. So, it's their life. Araw-araw nilang ginagawa yan. Hindi lang 30 minutes, baka maghapon pa. Kasi kailangan nilang yung training para manalo, no? Pero kung sa normal na tao, hindi naman siguro araw-araw mo gagawin yun, no? Unless meron kang malaking bahay, meron kang pool, kahit nga siguro merong pool sa bahay, hindi rin araw-araw nagsiswimming.
Yes.
So, I think the risk, mas less yung exposure mo, I think the risk is less also. So, yung hindi naman ito sinasabi para hadlangan ka, but just for you to consider na it is possible, no? Baka sabihin mo, ay, hindi na ako mag-exercise, pwede pala akong magkaroon ng asthma exacerbation pag nag-swimming ako sa pool. And I believe most of the asthmatics will disagree. Marami nagsiswimming dyan sa pool na asthmatics and they still feel good. Okay lang naman if ganun ang But yun, at the back of your mind, gusto ko lang malaman yun na it can happen.
Yes. Especially this time around, may mga certain gyms and sports venue that have opened already to entertain some players, athletes, or maybe non-athletes who could actually play already and do some sports. Yeah. Dr. we have a question from Mr. Quinto because this is actually related to what you mentioned. If it's a myth or a fact about swimming. I heard you mention about it a while ago. Kasi may siguro, yeah, it's up for you to clear, Doktora, no? Kasi may mga sinasabi din ng mga coaches, kanyan. Oh, so the best sport, because if you have a kid, di ba, in the school, sa elementary, sasabihin nila, which sport is good for you? If you have asthma, we encourage you to take swimming class, ganyan. So si Mr. Quinto, yung anak niya in-enroll niya because meron siyang childhood asthma. So is it a good decision to go for swimming?
May nangyari ba sa anak niya?
He has mild asthma and they're thinking of overcoming it through swimming. Yes po.
Nag-start na, okay. So, during the time na nag-start siya, nagkaroon ba siya ng exacerbation? If hindi naman, actually, I think yung sinabi ko about chlorine and swimming, ang sabi dun sa nabasa kong study, talagang pag pumunta ka dun sa pool na yun, amoy na amoy mo, na even the lifeguards, nagkakaroon ng exacerbation. So, ibig sabihin talagang nag-uumapaw na chlorine siguro yung ginamit doon. So, I think may na-experience mo rin yun na pag pumunta ka sa isang facility, amoy na amoy mo talaga yung chlorine, di ba? So, yun siguro yung kailangan mo i-take note. Kung yung facility na in-enrollan mo, yung kung saan man siya magsuswimming, hindi masyadong matapang kahit hindi ka nakababad. And I think hindi naman siguro ito 7 days a week, no? Kahit once a week lang naman niya usually yung mga ganyang swimming class. So, I think wala namang problem. And kung talagang meron siyang asthma, the pediatrician, siguro naman talagang nakabantay dun sa bata. And kung hindi naman siya naka-experience ng kahit ano, habang nagsiswimming siya, edi okay, baka hindi siya yung talagang population or hindi siya kasama dun sa mga possible na magkaroon ng bronchoconstriction.
Yes, yes. Parang we have to consider also what you're saying, Doctora, is the environment when you do your sports. No? Kasi for example, that one, chlorine, so they could inhale and could cause some lung problems also. And meaning to say, Doctora, not only for swimming, if you go for jogging, kunwari dyan sa may UP or UC Circle, ganyan. Tapos, ang dami ng sakyan, may air pollution, kumbaga. So parang ganun din, Doktora, na parang you choose also, you make sure that the area that you do your sports is clean because again, as you do your exercise, nagiging mabilis yung pag-inhale mo ng oxygen, etc. So if you inhale pollution, it will aggravate your condition instead of making you healthier. Tama po ba yun?
Tama.
Yeah. So bago mag-yoga, yoga sa garden, make sure nakapagwalis-walis muna.
Oo.
At walang usok o walang amoy na nakaka-disturb din.
Yeah.
Ayan. Okay, Doktora, we have a question from Mau Brillantes. And her question po, Doktora, is how about the role po of bronchodilators or certain anti-asthma for patients or people who have asthma? So when is the probably is can they stop or can they tailor what I mean to say is the titrate the dose kumbaga when they do exercise na regularly or still the same. What do you suggest?
So, yung asthma control, yun yung pinag-uusapan natin kasi ina-assess yan sa clinic ng doctor. So, we usually ask kung sa loob ng 4 weeks, ilan na yung panahon na nagkakaroon ka ng hingal or gumagamit ka ng extra inhaler, extra puff. So, dun namin ina-assess kung controlled ba yung hika mo. Based on that, dun din natin malalaman yung kung meron kang mild asthma lang or kailangan mo nung doble-dobleng mga gamot. So for those na may mild asthma, your doctor may or may not give you as needed medications or maintenance medications, yung low dose. So it still depends on the doctor who will assess you. Kasi marami pa siyang mga additional na tanong na gagawin. Now, if your doctor feels na kailangan mo mag-maintain using a low-dose inhalers, you should maintain it. No? At yung iba kasi, feeling nila dahil hindi na sila inaatake, it's time to stop. Pero baliktad po kasi siya. Kaya ka na hindi inaatake ng hika mo dahil gumagana na yung gamot. And yun yung tamang timpla na kayang kontrolin yung hika mo. So, with that, you cannot stop it without the assessment of the doctor, no? Baka sabihin mo, kaya ko na mag-exercise, okay na siguro. No, hindi ganun yon. So, kaya mas controlled yung hika mo dahil tumatalab na yung inhaler mo. So, ganun pa rin, ask your doctor if you can already lower the dose of your inhaler or stop it.
Ayan. Doctor, follow-up question. Does that mean that you encourage talagang having a regular exercise for patients who have asthma?
Well, kahit walang sakit, you are required na may regular. And also, it is recommended na for may asthma, minimum of 30 minutes, most number of days pa rin. No? In different forms of exercise.
Yeah. Thank you for that, Doctora. We have maybe two more questions, Doctora.
Sige lang.
We have a question from Ma'am Susana. And Doc, okay lang ba yung taekwondo naman? Taekwondo sports sa bata na may pneumonia po? Pneumonia naman, Doctora.
Pneumonia. Ang pneumonia, hindi naman siya laging nandyan, no? It is an infection caused by a bacteria or virus, no? And usually, after, mapapansin mo yun, ang bata after 48 hours of antibiotic, maganda na ulit katawan niya ang pneumonia ay hindi tumatagal na sakit, no? It is an acute infection. So, once that you have a pneumonia now, hindi yun ibig sabihin, forever ka na may pneumonia. It was just part of your history and it is good to know by your doctor. Pero hindi ibig sabihin nun, pneumonia is not a disabling disease unless sobra talaga yung naging effect niya sa baga mo na talagang when you do a chest x-ray, talagang may structural changes. But a pneumonia is an acute infection and one point in your life lang yon, no? Let your child do taekwondo, walang problema.
Mm. So, okay lang mag-sports. Tuloy pa rin yan, taekwondo,
Mm-mm.
and any kind of sport. Ayan. Thank you, Doktora. No? So, I believe we have answered the questions from our Facebook Live viewers and at the same time, some text-in questions that we got from them. So, probably, Doctor, as a last question, why should we take care of our lung health by doing exercise? How can really exercise help our lungs?
Mhm. Okay. So, exercise, actually hindi talaga yung baga mismo yung ina-exercise natin, but the muscles surrounding the lungs, no? So, yung mga accessory muscles natin for breathing, yun talaga yung pinapalakas natin to really help our lungs. So, it is really important kasi, yun nga, it is really part of, exercise is part of a healthy lifestyle. At pag ikaw yung healthy, you prevent diseases to come. And if you already have the disease, makakatulong siya to prevent maybe deterioration of your condition. So, I really encourage everyone to exercise in the form that is suited for you.
Ayan. So, thank you so much, Doktora. Any final word probably to some of the patients that you actually encounter during this pandemic when it comes to their lung issues or lung problems,
Okay.
so that
So,
probably others could relate to.
So, this pandemic talagang it's more on fear, no? It disabled us. It made us incapacitated to do things. But let us not allow fear to do what is right for our health. Lalo na if it's time to consult a doctor, you go consult a doctor. Pumunta kayo sa ospital. And wag niyong itatago kung kayo ay may ubo, kung kayo ay may sipon, because the doctor must assess you para mabigay sa iyo yung tamang diagnosis and tamang treatment, no? So again, let not fear overwhelm you this time of pandemic because nandito naman, we doctors are here, face-to-face consultation, telemedicine. Pwede kayong magtanong kung ano man yung condition na nararamdaman.
Ayan. All right. So with that, Doktora, we end this question and answer. Thank you so much, Doktora, for sharing your expertise and your time to everyone, especially to our Facebook Live viewers.
Thank you, Sir Aga, for having me here.
All right. Thank you very much, Dr. Grace. By the way, Dr. Grace, where can the patients could see you if they would like to seek for your expert consultation?
Okay. So, for those na merong mild, non-urgent na condition, pwede kayong magpa-schedule sa online Facebook page ko, Dr. Pancho Online Clinic. And then we will guide you on how to facilitate the appointment and the scheduling. But if you have a very urgent condition na kailangan face-to-face assessment or talagang alanganin na oras, I'm affiliated in Manila Doctors Hospital. That's in UN Avenue, Manila. And also in ACE Medical Center, Quezon City. That's in Project 8, malapit sa Memuños. So, yun po.
Ayan, all right. So once again, thank you so much, Dr. Grace and Pancho, for sharing your expertise and your time to all of us. God bless po, Doktora.
God bless din po. Thank you po, everyone. Ingat.
All right, so there you go, ladies and gentlemen, our doctor expert, a pulmonologist, Dr. Grace Ann Pancho, who actually shared some breathing exercises na pwede po natin gawin sa mga bahay natin without going out. Kasi, of course, with the pandemic that's happening around us and all of the restrictions that's being implemented. So we hope that you have learned from this discussion as much as we did. So guys, maraming salamat po again. We hope to see you next Sunday for another interesting and of course learning field topics here on Health Talk, your weekend source of good talk on good health, Health Talk. Have a great day. Bye, everyone.
Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Thank you po,
Ayan.
Sir
Ayan.
Patrick, Sir Aga.
Thank you, Doktora. Napaka cool nyo lang the whole time.
Talaga ba?
Yes. Talagang very, very maintained, very poised, very controlled yung the whole discussion ninyo. Kanina medyo hindi ako nakapagsalita agad kasi nagkwentuhan kami doon sa mga exercise. Kasi nga, di ba minsan yung mga lola, ayaw mapirmi sa bahay. May mga ganun, di ba? Kahit 90 plus na nasanay na lumalabas, nagtatrabaho. So, ganyan kasi yung lola ng wife ko. Ay, even at the age of 90, 92, actually hanggang 94, lumalabas pa rin almost every day to go to their store sa bayan. Sa bayan, kumbaga. Tapos talagang sa bahay, alas 4, alas 5, gising na, lakad ng lakad. Ganyan. Ayan. So, thank you so much, Dr. Grace. I will keep in touch with you again po.
Sige,
Via
sige.
Viber or text pala.
Okay, Sir Aga.
Ayan.
Thank you po. Thank you, Sir Patrick.
Thank you, Patrick. Thank you. Bye.